Nasogastric tube removal. During the assessment phase, we will assess the doctor's orders for the removal of the nasogastric tube. During the planning phase, we will gather the equipment that is necessary, such as a towel and an irrigation set. We will plan for assistance if needed. Good morning, Ms. Jones. How are you feeling this morning? Well, I have very good news for you. I have doctor's orders to remove the nasogastric tube. That means you're making progress. The very first thing that I'm going to do is go ahead and raise the bed to the working level. I want to put my side rail down, and I need to go ahead and assess bowel sounds. If the patient does not have bowel sounds, you need to notify the doctor. There could be a chance that you could remove the nasogastric tube and then the patient would require it to have it put in again. Mrs. Jones, I'm just going to listen to your bowel sounds, okay? And again, listen in all 4 quadrants. Mrs. Jones, have you passed any gas recently and/or have you had a bowel movement? This also helps you to feel a little bit more comfortable about removing the nasogastric tube. So bowel sounds are present. At this time, I want to go ahead and put on some clean gloves. Mrs. Jones, I'm going to explain everything to you as I go through the procedure, okay? I want to make sure that I put a towel across her chest. And I like to have the bucket right here, just in case. I want to go ahead and I want to turn off the suction. Now I want to go ahead and remove my safety clip. It does help if you can have your patient sitting up at a 90-degree angle. I'm going to go ahead and I'm going to disconnect the tubing from the NG tube. And I want to get my irrigation set, and I want to instill anywhere between 20 and 30 mLs of air. Mrs. Jones, all I'm going to do at this time is I'm just going to insert some air into your stomach. This will help get all of the contents that's in the tube out. So you may belch, okay? I'm inserting the air, and I like to go ahead and just leave the syringe on the tip. At this time, I'm going to go ahead and untape from the nose. Mrs. Jones, I'm just going to untape. Okay. Mrs. Jones, what I'm going to do is I need you to put your chin to your chest and hold your breath the whole time that I'm taking this out. This helps to reduce any chances for aspiration. Are you ready? Okay, chin to your chest. Take a deep breath and hold it. Ready? Hold it. And I remove. And remove. And remove. Very good. At this time, you may want to offer your patient some Kleenexes or anything to kind of clean up in the nasal area. Make sure that when you remove the nasogastric tube that you look at the tip and that the tip must always be intact. You don't want to leave anything inside the patient's body. Mrs. Jones, we are just about to be finished. I want to go ahead and put my side rail up, put my patient in a comfortable position. Just a couple of things that I would like to go over with you, Ms. Jones. At any time, if you start feeling like you're becoming nauseated or any kind of vomiting, please notify me, okay? Is this comfortable for you? Okay. And I'm also going to make sure that I put this whole bed back down to low position. Okay, Mrs. Jones, I'm going to give you your call light right here for you. You call me if you need anything at all, okay? During the evaluation phase, I want to make sure that I evaluate the nasogastric contents and amount as well as the client's status.